Catapres lowers blood pressure by decreasing the levels of certain chemicals in the blood. This allows the blood vessels to relax and the heart to beat more slowly and easily. Catapres is used to treat hypertension, high blood pressure. It is sometimes given with other medications. Catapres is also available as a transdermal patch for under the skin. Don't use two forms of this medicine at the same time. Indications. Catapres tablets are indicated in the treatment of hypertension. Catapres tablets may be employed alone or concomitantly with other antihypertensive agents. How to use. Take Catapres exactly as prescribed by a doctor. Follow directions on a prescription label and real all medication guides or instruction sheets. Your doctor may occasionally change your dose. Catapres is usually taken in the morning at bedtime. If you take different doses of this medicine at each dosing time, it may be best to take the larger dose at bedtime. Catapres may be taken with or without food. Usual adult dose for hypertension. Oral, initial dose 0.1 mg orally 2 times a day, morning and bedtime. Titration, increments of 0.1 mg orally per day may be omitted at weekly intervals to a desired response. Maintenance dose 0.2 to 0.6 mg orally per day in divided doses. Maximum dose 2.4 mg orally per day in divided doses. Taking the larger portion of the oral daily dose at bedtime may minimize transient adjustment effects of dry mouth and drowsiness. Contraindications. You should not take Catapres if you are allergic to clonidine. To make sure Catapres is safe for you, tell doctor if you have heart disease or severe coronary artery disease, a heart rhythm disorder, slow heartbeat, high or low blood pressure, or a history of fainting spells, a heart attack or stroke, pheochromocytoma, tumor of the adrenal gland, kidney disease, or if you have ever had an allergic reaction to a Catapres. It is not known if clonidine will harm an unborn baby. Tell doctor if you are pregnant or plan to become pregnant. Clonidine may affect fertility in men or women. Pregnancy could be harder to achieve while as a parent is using this medicine. If you are breastfeeding, tell a doctor if you notice somnolence, tiredness, rapid breathing, and poor feeding in the nursing baby. Precautions. Before you take Catapres, tell doctor if you have heart disease, severe coronary artery disease, a heart rhythm disorder, slow heartbeat, low blood pressure, a history of heart attack or stroke, kidney disease, or if you have ever had an allergic reaction to a Catapres. Avoid drinking alcohol. It may increase certain side effects of Catapres. Avoid driving or hazardous activity until now how this medicine will affect you. Dizziness or drowsiness can cause falls, accidents, or severe injuries. Avoid becoming overheated or dehydrated during exercise and in hot weather. Side effects. Get emergency medical help if you have signs of an allergic reaction to Catapres, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Call doctor at once if you have severe chest pain, shortness of breath, irregular heartbeats, a very slow heart rate, a lightheaded feeling like you might pass out. Common Catapres side effects may include drowsiness, dizziness, feeling tight or irritable, dry mouth, constipation, loss of appetite, or sleep problems, insomnia, nightmares.